Yes, live already. It start. Silakan Puan Sila, dah mula dah.
Right, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam Jumaat yang penuh berkat. Alhamdulillah hari ini kita akan menyambung presentation final bagi Post Basic Pharmaceutical Sterile dalam subjek OSH. Di mana siaran ini boleh dilihat secara terus melalui StreamYard dan juga dalam YouTube bersama dengan other speakers. So untuk pagi ini kita ada bersama saya panel yang begitu disegani dan berilmu, Encik Sazwan Aizat, dipersilakan. Encik Sazwan Aizat, apa khabar? Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah. Seterusnya untuk pada pagi ini kita punya presenter. Our presenter is Puan Soumini, anak perempuan Sirigaram. How are you? Good morning. Puan Soumini. Is it correct to pronounce your name? Hello Puan.
Hello.
Hello. Okay.
Hello.
Boleh dengarkan suara kami dengan jelas?
Boleh, Puan. Boleh.
Boleh. Alright. Right. So hari ni macam mana?
Okay.
Okay.
Little bit nervous.
Alright, a little bit nervous. Okay, never mind. Just relax and without any delay, we'll present our presenter for today is Puan Soumini. Okay, the floor is yours.
Okay. I would like to begin my presentation with activity 1. The given topic for activity 1 is handling of radioactive substances. Okay, let's see what is radioactive substances. They are substances that produce energy in the form of powerful and harmful rays. They are capable of giving off radiant energy in the form of alpha particles, beta particles, and gamma rays. A radioactive substance normally consists of a drug component and a radioactive component. They are administered into the body of the patient by injection, or inhalation. Normally used as a radio tracer to diagnose dysfunction in the body tissues, and also used to treat specific disease by acting as a therapeutic agent. Okay. So for today, I've choose technetium 99M as my radioactive substance. Technetium is a atom which is a silver gray radioactive metal. This radioactive metal mixed with a pharmaceutical component and administered to the patient via oral or IV administration. They actually have a very short half-life, which is 6 hours, and does not remain in the body or the environment for long. And it itself minimizes the risk of toxicity. The amount of radioactivity is expressed in the millicurie or millibecquerels, widely used in the medical diagnostic tools, and technetium give off gamma photons that are ideally suited for the imaging and counting by a gamma camera. Okay, when see about the hazardous radioactive substances, we should strictly follow some special precaution before handling them. First of all, we will see the PPE, personal protective equipment, which contain disposable gown, surgical mask, surgical glove, disposable hood if necessary, and disposable eye gear or goggle, disposable shoe cover, or in some places they use the toe cover shoes to protect their feet. Okay. Other than PPE, these are the materials that we have to take into account. First, the generator. Generator must always place inside its container. And the next one is L shield or glass shield, which we use to protect our eyes from the radiation. And syringe shield. Normally, syringe shield, they are made from lead and also used to protect our hands. Mm, syringe carrier also made from lead juga. Uh, they are used to keep syringes in terms of delivery until administered to the patient. Tongue. Use of tongue is to avoid direct contact with the radiation substance. Geiger counter. Used to detect the exposure or the contaminated surface. Okay. Dosimeter monitoring. Dosimeter monitoring is another essential part to measure the level of exposure of a personnel. There are two types. One is the whole body dosimeter. Here I use lip cell dosimeter, and the other one is TLD, which is thermoluminance dosimeter fingering. Okay, principle of ALARA. What is ALARA? ALARA is as low as reasonably achievable. ALARA actually focus on three main principles. First one is distance, second shielding, and the third is time. The distance, it's the more distance, the less exposure. The second is shielding. The more thickness of the shield can prevent or give less exposure. It can reduce the exposure also. And the third one is time. Shorten the time, decrease the exposure to the personnel. Spill management. Spill management, only trained personnel should be allowed to clean the spill. These are the items that contain in the spill kit or decontamination kit. Okay. First one is PPE to protect spill handle personnel. Chalk, marker, or tape for marking the area of the spillage. Paper, towel, or spill absorbent for the containment or absorption. Sharp box for containment of broken glasses or needles. Tongs or forceps for safe handling of suspected contaminated materials or sharp. Decontamination solution for the cleaning purpose. And last but not least, the signage. Okay. These are some special precautions that we need to take into account. Firstly, we must always wear the appropriate protective clothing. They use appropriate radiation shield to minimize the level of exposure. Next, to avoid internal contamination, we have strict hygiene. Strict hygiene is essential when handling radioactive material. Regularly check the radiation level of your working area and all objects used, or at least at the end of every working day. Dispose all the radioactive waste in the appropriate container. Lead and the inner and the outer layer normally coated with the stainless steel. Okay, that's all for my first topic. So I continue with my second task, which is my poster. Okay, this is my poster. Given topic is a physical hazard. I took pharmacy. So these are the main things that I observe in the pharmacy. First, the problem, I discovered the problem is the trip or injured by trip. The hazard here is the confined space. So the mitigation measure for tripping is better housekeeping, creating specific storage area and training staff. The second one, the identified problem is slip or injury. Hazard is the slippery floor, and the mitigation measure is proper cleaning and maintaining floor and report any spill immediately. The third one is circuit shock or a fire, which is due to the electricity. The hazard is electricity, and the mitigation measure is the proper placement of circuit away from the elements that poses a danger. And the third one is burn or electric shock, which is caused by the heat devices which used in the pharmacy. And the mitigation measure for this is the education plays an important role in reducing the injuries. So this is my very simple activity. Okay, for the health risk assessment, okay, I have to choose a chemical drug. So that I choose hydrogen peroxide 35%. Okay, first, let's see the chemical product and the company identification. The product name is hydrogen peroxide 35%, and it has another identification code, which is a CHAS number 7722841. The manufacturer is Proxicam LLC, and there are several telephone numbers to contact in case of emergency also. Second one is the hazard identification. There are some few hazards. Acute toxicity is categorized as oral category 4, acute toxicity inhalation category 4, skin corrosion or irritation category 2 subcategory B, serious eye damage or eye irritation category 1, special target organ toxicity is category 3, oxidizing liquid as a category 2. Okay, the danger. Okay, danger, it can cause a serious eye damage, harmful if swallow, harmful if inhale, may cause respiratory irritation, can cause skin irritation, and also may cause intensified fire or oxidizer. These are the pictogram. Okay, there is a precautionary statement for the prevention and also for the response. In the prevention, we have to use the outdoor or in a well ventilated area, avoid breathing the vapors, wear PPE, keep away the flammable items, take any precaution to avoid mixing with combustible or flammables, keep away from, again, the same thing, flammable materials. Okay, in the response, if in eyes, rinse cautiously with water for several minutes. If on skin, wash with plenty of water. If in the skin irritation occur, get the medical advice immediately. If inhale, remove person to fresh air and keep comfortable for breathing. If swallow, call a poison center or doctor if you feel unwell. In case of fire, use water for extinction. Composition, actually, hydrogen peroxide contains 35% of hydrogen peroxide and 65% of water. First aid measure, For the eye contact, immediately rinse with plenty of water for at least 15 minutes. If you have wear the contact lenses, have to remove, and first 5 minutes have to remove within the first 5 minutes, then continue rinsing. Skin contact, have to rinse skin immediately with plenty of water for about 15 to 20 minutes. For inhalation, if the person is not breathing, contact emergency medical service. Ingestion, rinse mouth, and this do not induce vomiting. Okay. The most important symptoms and effect is necrosis, and also can cause injury to organ if the large amount has been ingested. If in case of skin contact, it can cause burn, hail, inflammation, and pulmonary edema can occur. And indication of immediate medical attention should be given for the eye. It can cause a corneal damage. Firefighting measure, nothing but the water is the main media for media used for the extinguishing media. Specific hazard that arising from the chemical is when it actually should be kept in an unventilated container. Otherwise, the pressure inside the container can increase and can cause decomposition. And that decomposition can cause fire. For the firefighter, we have to use water spray to cool the fire exposed surface. Accident release measure. For the personal precaution, avoid contact with skin, eyes, and clothing. Keep away people from any spill. Other than that, combustible material exposed to hydrogen peroxide should be immediately submerged or have to rinse with large amount of water. Handling and storage. To handle, we have to wear all the appropriate PPE. Never return the unused hydrogen peroxide to the original container. It can cause decomposition as well. Storage have to put in a vented container and away from the direct sunlight. In the exposure control, I'll see the appropriate engineering control. Ensure that eye wash station and the safety shower are close to the workstation. For the eye or face protection, we have to use goggle or full face shield made of polycarbonate acetate. Skin and body protection, we have to wear the impervious clothing such as PVC outer shell without polyester substrate. For the hand protection, we have to wear gloves made of nitrile or PVC or neoprene. Respiratory protection, use NIOSH or DHHS approved self-contained breathing apparatus or other approved air supply respirator. Okay, these are the physical and chemical properties. Hydrogen peroxide is actually a clear, colorless, odorless liquid form which has boiling point range 108 degrees Celsius. And it's a strong oxidizer. Stability and reactivity. It is actually a reactive and oxidizing agent and stable under normal condition. Hazardous polymerization does not occur. Condition to avoid, we actually have condition to avoid is away from the excessive heat, contamination, exposure to the UV rays, pH variation. Hazardous decomposition product, oxygen which support combustion. For the toxicological information, serious eye damage. It can cause serious eye damage, moderately irritating for the skin. So the information on the toxicology symptoms: upper airway irritation. If delayed and immediate effect as well as a chronic effect from short and long-term exposure, there are inadequate evidence for the carcinogenicity. For the mutagenicity, this product is not recognized. Reproductive, also no toxicity in the reproduction in the animal studies. Targeted organ is the common one: eye, respiratory system, and the skin. Ecological information. Material may have some potential to bioaccumulate, but will likely to degrade in most environments before accumulation can occur. Mobility, it's mobile in the environment due to its water solubility and will likely degrade over time. Disposal consideration. Dispose of in accordance with the local regulation. Transport information. It should be transport in non-vented container for the cargo, and they are not allowed for air shipment. While transporting, we should keep the drums in an upright position. For the regulatory information, acute health hazard is yes, and the fire hazard also, yes, it's present. So the international inventories and the other information as below, we have graded as 4 is severe, 3 is serious, 2 is moderate, 1 is slight, 0 is minimal. OX is symbol for oxidizer, hash is for protection. Okay, now this is my product form. Okay, hazard identification here. For the hydrogen peroxide, I think dilution process, the hazard is exposure to the personnel and the effect that can cause to the eye, skin, and for the respiratory tract. And the second activity is handling of the spill management. Also, the hazard is exposure to the personnel, and the effect is eye, skin, and respiratory tract. Third one, storage of bulk stock in a high rack without proper warning label on the rack. So the hazard is accidental fall or exposure. Again, the effect, I give eye, skin, and respiratory tract. Risk analysis. There are some existing risk control which have been taken before. So for the dilution process, we have appropriate PPE. Handling of spill, also they have the spill management guideline and also wearing PPE. Storage of bulk stock, now they have a cabinet at the lower rack with the proper warning sign. And the likelihood to happen while dilution process, I give 4. Severity, I give 1. And handling of spill management, 1 for the likelihood, 2 for the severity, and risk is 2. Storage, I give likelihood as a 2, severity also 2, and the risk is 4. Risk control. Risk control measure, I think for the dilution process, still using the PPE. And for the PPE, I suggest use the apron which made of polyvinyl chloride or neoprene. For the handling of spill management, follow the existing guideline and also wear the PPE. Storage of bulk stock, I've given the follow the existing storage guideline. And also keep away from clothing and combustible material and out of direct sunlight. Okay, thank you. That's all from me.
Alright, thank you Soumini. Presentation yang menarik. Thank you for your good attempt. So without any ado, I pass to my colleague Mr. Shazwan Aizat for the comment.
Thank you, Puan Mazdila, for the opportunity to comment for this presentation. First of all, I would like to say very good attempt for Puan Soumini. You are trying your best in talking about the hydrogen peroxide for the SDS, and then you are also discussing about the hazardous agent with regard to the high rec and so on. Okay, so based on the information given from your submission, I think your high rec form have to be need to be updated now because I can see here there is an identification looking into the process, which is the activity is good. Okay, I share with you my slide so that you can get clear picture what is actually the comment I'm talking about. Okay, Puan Soumini boleh nampak ke? You can see that this is your presentation slide, right? So the hazard is exposed to personnel. So hazard is actually defined as what? This is the repetitive exercise lah. Hazard, what is the definition of hazard, Puan? What you understand about hazard? Apa itu hazard? Ya, Puan Soumini?
Hazard.
Hazard adalah
Hazard. Yes.
hazard. Okay, never mind. Because of the interest of time, I give you the answer. Hazard is the anything that can cause harm.
I classify as
Okay, anything that can cause harm to
something
human.
that can.
Yeah. I can hear you after the 5 second of my explanation and answer. It's okay.
Yeah.
It's okay. So this is need to be rectified back now. Okay. So this is the first comment. The second comment, of course, is a generic comment. For the hydrogen peroxide, please also did some sort of risk assessment towards the use of this chemical. Okay. You need to establish the level of exposure, the level of frequency, the level of duration, and their magnitude, and so on, to know about the ER. So if we evaluate based on this, we can know already what is the HR. So if I ask you, what is the HR for this one? You know the HR? Hazard rating for this hydrogen peroxide? 1 until 5. Which one you choose and why? 1 until 5. Hazard rating for hydrogen peroxide. Can you answer that one, Puan? Can you listen to me? You can't hear me. Okay, never mind. I'm going to make a repetitions. So my questions is, your hazard rating, your HR hazard rating for this hydrogen peroxide 35%. What do you think about this hydrogen peroxide hazard rating 1 until 5, and why you choose those values? Can you please answer this question? Okay, never mind. Never mind. I type it.
sorry, I can't hear you.
It's okay, it's okay. I type it. Hazard rating for hydrogen peroxide, 1 until 5. What is your opinion? Okay, I give a comment over there, Puan. If you cannot listen to me also, you can see the chat over there. You can see the chat. You also cannot see the chat. Okay, it's okay lah. Never mind. I think that's all for me. Thank you. Go back to Puan Masdilah. Thank you.
Alright, thank you Cik Sazwan Aizat. Okay, Soumini dengar ke suara saya? Can you hear me? Dengar ke Soumini? Can you hear me?
Dia putus-putus.
Putus-putus. Okay. I just want to put comment for a simple one. For task number 1, is it I think salah type lah, I think can Cik Aizat show the slide? Syamini show the slide. Regarding the technetium 1999. For
Never
the
mind.
unit,
Never mind. I share the slide. So which one, Puan? Which one you want?
task one.
This one?
Okay. The only the simple one lah. The unit of the millibecquerel and millikillium tadi. I think you typing error on there.
Okay.
Where is it? Ni.
Dia punya unit ke pun?
Task one kan? Yes. Try tengok task two. No, task two okay. Unit millikillium tadi tu. I think task one.
I think she made some update, I think.
Oh, is it?
You made update on your slide, Puan?
You ada salah typing tadi dekat dekat unit. You said millikillium but the typing is MB. Something like that. So please amend for that things lah. Okay? So Mini dengar? I kena type ke?
I think
Typing
she got some
error.
difficulty in her connection. Dah, it's okay.
Dah habis
So-
dulu. Okay lah, so tak apa. Nanti kita akan bersambung semula selepas ini. Then we go to the next presenter. See you then. Assalamualaikum.